Molly Prieto of the Department of Health and Human Services and Justin Kerr of Google Public Sector. Welcome to both of you. Molly, I start with you. How are you approaching the next generation of standard setting for EHRs?
Well, standards happens to be one of my favorite topics, so it's a good place to start. First of all, thanks so much for having me. So standards-based certification and functionality has long been a stalwart of ONC, which is the Office of the National Coordinator within Health and Human Services. And standards-based has been the direction of making sure that systems can talk to each other and making sure that interoperability is here and now. I know one of the things that I always hear from my family members is, why do I have so many different portals? And why do I have to log into all of these different places to get information? That should be more easily accessible. And one of the ways that we can do that is by making sure that standards are the foundation of all of the systems that hospitals are using and providers are using and that we're using when we log in to access our own information. So standards-based is certainly the way to make sure that we can speak the same language to each other. As someone who is not bilingual, I really appreciate them when systems are able to, do that translation for us and make sure that, if I'm being seen at a hospital and then at a new physician 2 weeks later, that physician could access that information. So standards is really the way to make sure that we're driving on the same road, speaking the same language.
What are the carrots and sticks that are available to an organization like ONC to drive compliance? Maybe is the wrong word, but cooperation among all of the various stakeholders here?
Absolutely. A very important question, right? It helps a lot if everyone is playing the same game. So one of the things that ONC has is the certification program. And our certification program, while voluntary, is reinforced by our friends over at CMS. And CMS has a few different programs that include payment incentives, programs like promoting interoperability, and they do incentivize the use of certified systems, and they also incentivize the use of certain standards. So by encouraging the use of certified systems and technology that is using standards-based functionality, and we're able to really work nicely with CMS to be sure that the providers and hospitals are being incentivized for the use of functional tools.
Justin, welcome. It's great to have you here too. She talked about everyone playing by the same rules. What does that look like from an implementation or practitioner perspective?
Right. Yeah. And thanks for having us. I think you brought up CMS and also how you partner from a ONC ASTP perspective. And one of the, in addition to standards and kind of the rulemaking that goes on, there's also voluntary programs. So CMS is a health tech ecosystem that recently launched. So Google, among other companies, signed on, Google overall, not just the part I'm in public sector, but to kill the clipboard, right? So how many times have we all gone to the doctor? You filled out the forms online, you filled out the forms last time, you show up again, you get handed a clipboard to put in yet, write down the same information again. So how do we get out of that even when some parts of the system don't have standards yet? And so why is it that I can put a concert ticket in my virtual wallet, but I can't put my health insurance card in many cases? So how do we create ecosystems that sit with and alongside standards, but that even are implemented voluntarily through kind of initiatives that provide a space to develop those shared ways of working and kind of ways of collaborating.
When you talk about creating an ecosystem, how much of that is technology infrastructure and how much of that is cultural in changing the way that organizations do business, process patients, all of those kinds of things?
Absolutely. And I'm lucky because I get to do the technology part. And I think that's usually, in a lot of ways, can be the easier part, right? But it's really a multiplier and an enabler. If we can figure out the technology and remove that barrier, then I think it can create the avenues for people to actually make it real, to have the cultural change and to have, see the value, right? Because no one's going to continue to invest in developing new ways of working if it's not kind of delivering those outcomes that patients are really looking for.
Molly, Tim and I talked in the first part of this program about artificial intelligence. How are you seeing AI impact the way that people think about standards and implementation?
Absolutely. I don't think we'll be able to get away from AI anytime soon. And it is a tool with a huge amount of potential. So one of the things that, as the government, what we've been trying to find is the right balance between making sure that places like Google and all of the, private sector developers have space and room to be innovative, and while still making sure that patients and providers trust the systems that they're using. And so one of the ways that we think is a really good way to make sure that, providers trust the information that they're getting back from, AI is transparency. And so how can we, kind of make sure that everyone who is using the tool understands what the inputs are? I know Tim mentioned, making sure that the data is good. In a prior life, I also used to do implementations, and I always said garbage in means garbage out. So how can we be sure that that's high quality data, and that when the tool is, using all of that information, that it is then giving answers that the provider trusts. So transparency is a great way to do that. We have some of those transparent features built into our certification program. So Certified Technology is being transparent about the way that they're, designing algorithms and making those answers available to the users. So I think that's one really important part. The other thing that the federal government can help do is incentivize use of new technologies. And so I know the department has been, really big in making sure that there are funding opportunities. I think in the last segment, you also talked about the Rural Health Fund, Transformation Fund that will be available soon. And so that's another really great way to encourage the use of, new cutting edge technology, perhaps in places in the country that haven't, had the same influx of funds in the past.
Yeah, the challenge I imagine in that area is a lot of those parts of the country are getting bandwidth where they've never had it before.
Certainly.
But the technology to leverage that bandwidth is not as readily available there as it should be, and they might be the parts of the country where they need it the most.
Absolutely. I grew up in a very rural area, 500-person town now, sadly, I think down to about 400. But I still don't have cell phone service when I visit my family members there, and they only recently got internet that wasn't dial-up. So certainly understand, the challenges there. The closest hospital to that area is 40 minutes away now. So making sure that as we're investing in those communities, that we're investing in the right things first. Certainly broadband is a good way to do that. And then making sure that the industry is able to provide tools that can work in a variety of ways, whether that means having downtime procedures or being creative about the way that they could download things offline.
Justin, how is the rural healthcare scene, landscape, being impacted by some of these kinds of issues that you're working on?
Sure, and I think maybe tying together some of those points about accessible technologies and bandwidth constraints and things like that. We had a great partnership with a partner called Drive Health in the state of Illinois, serving the use case for maternal and early childhood health. So in these underserved populations, how do you reach and have enough contact points for care during pregnancy, early postnatal? And so what Drive team has is a virtual nursing assistant that can do follow-ups and check-ins with those patients, and they supplemented that with Pixel phones and Fitbit devices. So all in the Google ecosystem, we're very lucky. So those kind of, now you have a wearable, you can actually take continuous readings, right, and monitor health. If the patient opts into that kind of a program, you're getting those readings without having to go to the doctor and check in on those things. You're getting that kind of out of the box. And then with a mobile device, you maybe can have, care engagement, reminders, things that increase accessibility without, again, going, having the provider there, maybe not at all, or needing to go in person and do that, especially with, a newborn.
Two items that we talked about earlier in the program also come to mind as you're talking about these issues: privacy and cybersecurity. A lot of PII, a lot of personal information to protect and to make sure that is protected from all kinds of potential threats. What does that look like from the ONC perspective?
Sure, that's a great question. So within our certification program, also, we do have some components to ensure that certified systems are meeting privacy standards. Our friends at OCR, the Office of Civil Rights, who are responsible for much of HIPAA and making sure that folks are complying with those, are great partners. And so we've worked with them in the past to have a security risk assessment tool that hospitals and providers can use on their own, do some self-assessment, make sure that their systems are meeting their expectations and are meeting the certification criteria. So that's certainly one way. I think another component, you asked about standards to start. There are some newer standards that are up and coming. Fire APIs, one of our favorite topics to talk about over at HHS, but there are new ways to do consent and more ways to ensure that the data that is being exchanged is privacy protected and privacy forward. So that's certainly certainly using standards is another great way to ensure that all of our data is kept safe.
You've mentioned the certification process a couple of times. What does that entail, and what are you certifying to whom?
Sure. So the ONC certification process is a series of criteria that EHRs or other health information technology can demonstrate that they have, met those foundational criteria. And we have partners that work with them to go through testing, and so they can test their systems, demonstrate that they're meeting these criteria, for example, the privacy criteria. And then once they have demonstrated that they meet all of these criteria, then they are considered a certified system, and then providers and hospitals can use those certified systems in programs like promoting interoperability that CMS runs to demonstrate that they're using technology in a meaningful way. So we can nerd out about certification all day, but it's a program that's been around for many years, and we recently updated it in the last two years or so.
What drives those updates? Is it incremental gains in technology? Is it gains in demands from patients or from the healthcare systems providers?
All of the above. So we hear a lot of feedback, from the developers, from patients, from clinicians about, what challenges they're facing and how we might be able to better address those. Another one, not to be a broken record, is standards-based. So as standards are updated and released, we want to make sure that the program is referencing those most recent standards. I think the last time we updated, we had some that were 10 years old. And so making sure that we're able to stay up to date and that the technology can reference the most recent ones. We don't want to be the reason why folks aren't able to innovate or move forward. So much of it is to make sure that the systems are rising to meet modern technology and most recent standards.
Justin, I noticed while she was talking about Fire API, you were particularly, you got really excited, jazzed about that.
Yep.
What about that concept struck you?
Yeah, so I think making those data accessible and also, again, across use cases. So certainly interoperability for patients having access to their own personal health records, being able to share them seamlessly across providers, but also to have enough both ability to work across the standardized data and the unstructured data powered by, emerging AI capabilities to, for example, at the Uniformed Services University of Health Sciences, where our nation trains the medical personnel to care for military service members and their families. So we have a partnership with USU where they are developing models to help inform care. So, for example, their first model they deployed with this system was about wound closure. So a lot of different factors could go into what's the ideal time to close a wound to minimize the potential for complications. And they have a big amount of data that they can inform those decisions from past patients and their outcomes, but then bring that model into consideration with the patient that they have, in front of them. So how do we take that big pile of data and create meaningful models that can inform clinicians and say, okay, maybe in this case, with this patient's history, it's better to wait a little longer, to close earlier. In that case, that's just one example of how you can build, value out of once the standards are there, then the data become accessible, then you can scale, innovation in healthcare.
Are the data analytics tools to perform that kind of analytics similar to other types of analytics tools, or are they unique to that particular application?
Great question. So a lot of the foundational technology is shared, and one thing that, for example, FHIR standards give you is a way to reference those data in a repeatable way. So just like in other, technology schemes, right? We need to kind of understand the data we're going to get in order to make meaning of it at scale without a lot of extra work, and that's what a lot of those standards set the foundation for. And then we can operate on them at scale, more seamlessly, whether they be FHIR or, unstructured with, AI-enabled ways to look at those data.
Now I understand why you were so excited when you talked about that. What do you think, Justin, will continue to drive innovation from the technology company perspective like yours? What will incentivize you to want to keep driving forward on these kinds of things?
Sure. I mean, Google's a big place, but I love to work with HHS and the divisions within HHS, and we have long-standing work with NIH. So one of the things that gets me very excited is connecting healthcare and basic research. So now we're at in a new era where we have a great feedback loop from basic science into healthcare, and really quick ways to bring the things we can learn from healthcare, back into basic science. So for example, at NIH, they had an initiative where they wanted to, at scale, provide medical images for research R&D applications, right? How do we make the next best model to look at images and detect cancer early or help clinicians? And to do that, you need properly de-identified, non-re-identifiable medical images, X-rays, CT scans, to create and train those models with. And so how do you do that? Well, humans can take away the MRIN and the patient name and things that shouldn't be available in that use case, but that's very laborious. So if we can get a machine to do that, to redact that information, then we can scale this much more quickly. So that's kind of the promise, where you can operate at these new scales by using tools powered by AI to kind of make the information available across those dimensionalities, where it needs to be identifiable for an individual patient, where it needs to be de-identified to power biomedical research.
We have about 30 seconds left, Molly. What will you be tracking moving forward in all of the areas that we've talked about? What's kind of over the horizon now that you expect, if we got together a year from now, we'll be talking about?
Yeah. Well, Tim told an amazing story about his daughter playing doctor and having a computer in front of her. And I thought, oh my gosh, I want in a year for that computer to not be the center of the visit. I want it to be the patient again. But I think a good way to get there is making sure that we're encouraging innovation, using the most up-to-date standards, relying on our friends in industry to make sure that those tools are available and accessible, and helping use, federal government resources to be able to make sure that they are available everywhere, regardless of geography.
Molly, it's great to have you here. Justin, thanks very much for joining me.